Hello, good morning to you, and many thanks for joining us. You're watching Galaxy today, coming to you from Galaxy Television. It is the Health Edition. My name is Justin Akadoni.
I know that he's joined by Uche Onyekoviji. Like you rightly said, it's the health edition. And today, we'll be looking at prostate cancer. I mean, this is something that is fast killing, but then we hear more like it can be treated if detected early, right, Justin?
Yes, prostate cancer is one of the most common, types of cancer in men. Usually, prostate cancer grows slowly and is initially confined to the prostate gland where it may not cause serious harm. However, while some types of prostate cancer grow slowly and may need minimal or even no treatment, other types are aggressive and can spread quickly. So basically, that's what we'll be focusing on the health edition on the show this morning. And as always, we want you to participate and interact with us as we do it on social media using the hashtag Galaxy Today. You can also send SMS for our doctors. We will reach out to doctors in Abuja and, of course, in Ibadan. But just before we get to introducing our guest, let us take this particular report as put together by Godfrey Eshomage. He interviewed a professor of, urologist and urology rather, and he'll be talking to us about tips to look out for on prostate cancer. We'll be right back to join us again.
Research on prostate cancer in Nigeria is at its early stages. We still don't know exactly how common prostate cancer is in Nigeria. We think it's one of the most common, if not the most common cancers in men. And if that's the case, if the rates of prostate cancer are similar to other parts of Africa or the United States, it's a major public health problem. Cancer of the prostate is likely to be found in most men, even if you look hard enough. Although most men won't die of prostate cancer, it's still a very commonly occurring disease. The perception of cancer in Nigeria is very variable. Individuals who have education and understand what cancer is, the fact that cancer can be prevented or treated, they might have a very good chance of doing well and avoiding death from cancer. But of course, there are a lot of cultural beliefs around cancer. There are a lot of superstitions. People who don't understand what cancer is or why cancer is caused, they may not feel that they have anything they can do about a cancer. They may not feel like there's a way to prevent it. And in many cases, they just don't want to know. They don't want to discuss it, and they don't want to deal with it. But we can prevent and treat cancer. So the more education we have, the more likely we can save lives. If people realize it's a disease, we know some of its causes, and we know what to do with it. They don't need to be afraid of it. There are things we can do to keep people from suffering and dying of cancer. Is caused by many different factors. Prostate cancer is probably more genetically caused. Lifestyle factors are not very well understood for prostate cancer anywhere in the world. And so prostate cancer is, in that sense, not a rich man's disease. It's not a disease of Western diet. It's not a disease of things that a Western lifestyle would cause. So other cancers, actually infectious cancers, are very common in the low and middle income countries and places in Africa. So cancer is definitely not a disease only of the rich or the well-developed countries. It's very common in Africa and other low and middle income countries around the world. Cancer include, at a very early stage, urinary difficulties and may have varying symptoms, but later on, as prostate cancer symptoms get more and prostate cancer gets more developed and the disease spreads, it may be more a symptom of bone pain and other kind of pain that the cancer is causing at a distant site. I mean, that's a common notion that many people have, that if you're diagnosed with cancer, there's nothing you can do about it. It's a death sentence. And that's not true. Most cancers can be treated. And in fact, smoking in the cause of prostate cancer. So those factors don't seem to make a big difference. However, obesity, lifestyle and other kinds of factors related to lifestyle do seem to provide a worse prognosis once somebody's diagnosed. So in the same vein as you're saying, is prostate cancer a death sentence? What we think is that there are lifestyle factors that a person can use to improve their chances of not dying of prostate cancer once they have the disease. So there are certain kinds of preventive agents that have been tried, drugs that might lower the risk of prostate cancer. But currently the best way to keep someone from dying of prostate cancer is to detect it early. And we have screening tools that help us to identify prostate tumors when they're very early so they can be treated and the patient can be cured. So there are preventive strategies. They're not widely used in Nigeria at this time. We in the United States have done a variety of interventions to try to prevent or detect prostate cancer early with varying success. And I think we know a lot about what the right things to do are at this point. Now comes the time that we need to implement some of those strategies in Nigeria, and I think we'll have a much better way of approaching the problem than we have in the United States because of all we've learned over the past 20 years. Well, you're very fortunate right now because your Minister of Health is a cancer specialist, and he's somebody that understands both the prevention of cancer because he's worked in cervical cancer where prevention is possible, and he also understands the value of treatment. So I think that it's a multi-pronged approach that has to be developed. We have to develop strategies that prevent cancer and detect cancer early. That's the best way of preventing death from cancer.